Hey guys, welcome back to my YouTube channel. So today's topic of discussion is bone and its basic structure. So let's get into the video. Bone is nothing but a connective tissue composed of cells, fibers, and a ground substance. Typically, almost every bone consists of an outer layer of compact bone and an inner layer of cancellous bone. The compact bone typically forms the outer shell of the bone and is very hard in nature as compared to the cancellous or the spongy bone which forms the inner yellow bone marrow. The cancellous bone consists of lot of trabeculae which incorporates the blood vessels and the nerves which pass through the bone. Typically these trabeculae consists of lot of spaces so that it can house the blood vessels. Thus, the spongy bone is not as strong as the compact bone. The bone consists of the inorganic as well as the organic component, with the inorganic component having mainly bone minerals, which is the hydroxyapatite crystals, and the organic, which contains collagen and non-collagenous proteins. The compact bone typically has an outer and an inner layer. The outer layer is also called as the periosteum, and the inner layer is called as the endosteum. This entire outer layer thickness is nothing but the compact bone. This portion in the between, which shows trabecular pattern, is nothing but your spongy bone or the cancellous bone. The periosteum that we just spoke about again is divided into two layers, the outer layer and the inner layer. The outer layer is a fibrocollagen layer and contains a fibrous connective tissue, whereas the inner layer is an osteogenic layer and houses lots of bone cells and is rich in vascular supply. Together, this entity is termed as the periosteum. The inner surfaces of the compact bone is covered by a thin cellular layer and is called as the endosteum. In resting adult bone, osteoblasts and osteoprogenitor cells are present in these endosteal surfaces. Now let's take a cross section of the periosteum and have a look at it microscopically. Make note that the microscopic features of the periosteum and the endosteum are similar to each other. The bony lamellae are arranged at small concentric layers around a central vascular canal or a central vascular channel. This is termed as the Haversian canal or the vascular canal, and along with the concentric lamellae together this system is called as the Haversian system. This system can also be termed as an osteon. Adjacent to these Haversian canals, there are something called as Volkmann's canals. They are nothing but interconnections or channels that contain blood vessels, creating a rich vascular network throughout the compact bone. The bony lamellae present in between osteons is termed as interstitial lamellae and are remnants of osteons which are left behind during remodeling. Let's look at a typical long bone of the body for an example. You can see that it is divided into two main sections, that is the epiphysis and the diaphysis. The epiphysis forms the rounded ends of the long bone, whereas the diaphysis forms the mid shaft of the long bone. See how that this bone is covered by a layer of compact bone with a yellow bone marrow in the between. Red bone marrow is present within the cavities of spongy bone of long bones and diploe of short bones. They contain both fibroblasts and stem cells, otherwise called as mesenchymal cells, and is the main focus of formation of the RBCs. The two main cells, that is the osteoblast and osteoclast, help in bone formation and resorption as and when required throughout the life, which is termed as bone remodeling. In the upcoming video, we will discuss about the different ossifications of bone, so stay tuned. If you like this video, kindly like, share and subscribe. Thank you for watching, stay safe and have a good day.